You don't have to touch the child. They have scarlet fever. You get the diagnosis only by observing the child. Nothing else to do. Anything else, auscultation, palpation, it would be in addition to the diagnosis. Morbilliform rash, some T4, predominance in the trunk, significant involvement of around the natural orifices. So you have the diagnosis of scarlet fever, just for actually by observing the child. And this is another classical pediatric rash, that you discover only by observing the child. You have the trunk, the morbilliform, classical morbilliform rash with multiple papulas, maculopapula, so multiple or diffuse maculopapular rash. That's a morbilliform rash. Of what disease? We don't have this disease almost ever in the United States. I don't remember last time that I saw it, but there are bouts of measles still reported in the United States. Morbilliform rash in the trunk, you see the classical conjunctivitis that precedes the symptoms. The cataract period, the cough is the spot in the inner side of the mucosa. You see the predominance of the rash in the back, and involvement of the palms and soles. But again, this classical rash in pediatrics that I'm presenting to you is just to make a point that only by the first glimpse with the child uncovered, and the second glimpse, the first glimpse with the child as it is, and the second glimpse with the child uncovered by the parents, without you landing hand yet, you can make the diagnosis. This is another classical rash. You see, fifth disease. What is the virus that causes this condition? Slab-shaped disease. You see only by what? By looking at the face. First glimpse, just by looking at the child, and looking at the uncovered skin. The lazy, morbilliform. This is different. This is not a. This is maybe morbilliform rash as well, but lacy type of appearance. It's not as palpable. You see it on the skin with a slab cheek disease or fifth disease. What organism causes fifth disease? Parvovirus. So you see that patient, you know already that you're going to prescribe antibiotic, or what you're going to do is to reassure your mom. And your exam further is going to be aimed to, getting more fine-tuned exam like hepatosplenomegaly, joint involvement, etc. But you know that this is a very benign and common disease in pediatric, and all you're going to do after that physical exam is just to reassure the parents. And by uncovering as well the genitalia, very important. I have an anecdote with one of my first teachers that I was in the emergency room, and he came with readability, and I didn't uncover the genitalia. One of the most embarrassing moments in my career as a pediatrician. First time that I did my 301 in Cuba. Very embarrassing, very irritable child. And I just examined and listened to him, listened to the lungs. I said, this child doesn't have anything, maybe viral, a little bit of runny nose, go home. In the outside of the emergency room, there was a attending waiting. He said, you uncovered it, and you uncovered the diaper. You took away the diaper. And it was both a hydrocele, tension hydrocele, and a child similar to this. What is that? Candidiasis. Hallmark of candidiasis just by observing. Two hallmarks in clinical pediatrics. Involvement of the skin folds. Whenever you see a skin fold involvement, and how do you call this lesion there? Satellite lesion. You made the diagnosis of candidiasis. What do you do there? Local anesthetic of fluconazole. Right? So